This podcast is for informational purposes only and does not dispense medical advice. Always seek the advice of a physician or other qualified health providers if you have any questions regarding a medical condition. Never disregard professional medical advice or delay in seeking such advice because of something you have heard on this podcast.
Hello, everyone, and thanks again for listening to Prostate Cancer Real Talk. This is Shay, and today we have an amazing show for you. Today we're going to talk to Dr. Francis. Dr. Francis is a relationship therapist, counselor. And the show today was so amazing. I actually had a therapy session myself that I really didn't even know I needed. We talked about the emotions that one will experience with being diagnosed with prostate cancer. And it's not even just about the guy, but also the spouse. I hope that you really enjoy the interview that we did today with Dr. Francis.
Welcome to Prostate Cancer Real Talk. Did you know that 1 out of every 8 U.S. men will be diagnosed with prostate cancer during his lifetime? 1 out of 8. And black men are 50% more likely to develop prostate cancer in their lifetime and twice as likely to die from the disease. But we're not here to quote statistics and tell you how tough prostate cancer can be. Rather, we are here to create a supportive community of survivors. A place where we can discuss the real-life coping methods from the perspective of a married couple who are living through it day by day. This is Prostate Cancer Real Talk, how prostate cancer can affect state of mind and relationships. This week, we will be discussing the mental and sociological challenges for the patient, the spouse, family, and friends, and their coping tools. We're delighted to welcome to our podcast Dr. Kitson Francis. He's the founder and CEO of Family Consult and Counseling Service in Huntsville, Alabama. He provides counseling and interventions for families, individuals, married couples, substance abuse, grief counseling, medical illness, and more. Dr. Francis works closely with his clients in a warm, personal, and totally hands-on manner. He's very unique because he works individually with the client, from system intake through resolution, and frequently includes free follow-up sessions as a part of his service. Dr. Francis gained national recognition as the marriage counselor on the reality OWN Network's reality TV show Love and Marriage Huntsville. For more information on reaching Dr. Francis, visit our website, prostatecancerrealtalk.com.
Thank you very much, Dennis, for that great introduction, and welcome to our podcast. So, Shay and I, obviously, we saw you on the show that Dennis just mentioned. And as we put this podcast together, we thought it would be a great idea to get your perspective on relationships, particularly on the subject of people who are facing, couples who are facing prostate cancer. So with that, you and I have talked a little bit before the show. And I'd like for you to give us your opening comments, your thoughts, anything you'd like to say on this particular subject.
All right. Again, I just want to thank you so much for this invitation to be on your podcast. Let me just frame this. And I'm a man of faith. Let me say that. I don't know about you.
Yes.
I don't know about your people, the people that will frequent your podcast. So I just want to set a scene here for you when it comes down to couples and whatever happens with them. So at the end of creation week, God, on the sixth day, what he did was he created Adam and, created all the animals. And then what he did was, fast forward, he put Adam to sleep, the first anesthesiologist, the first anesthesia that was ever done, put him to sleep, took a rib out of his side, put him back up, no scars, no nothing. And then he brings this beautiful woman to him. And he looks at her and he says, bone of my bone, flesh of my flesh. God didn't tell him where he got her from. He just looked at her and just said, bone of my bone. And with that, there is this piece that comes into my mind. It says, well, if that's the paradigm of marriage, because that was the first marriage, if that is the paradigm, and he can say, listen, she's bone in my bone, flesh in my flesh, then what I'm saying here is this, that marriages today should look at that and say, my wife, Marlo, is the other part of me, not piece, but the other part of me that lives outside of me. I am the other part of her that lives outside of her. If we embrace that, then everything that I'm going through, biopsychosocial, she should be sharing going through that. Because if I'm going through something, okay, I am what I call the symptom bearer. Because she's the other part of me that lives outside of me, she then becomes a symptom sharer. I carry her, but because of our love for each other, she shared. I just want to say this, that whatever it is that are happening to couples out there, whatever is going on with one couple, one part of the part that's living outside of the other, if they truly embrace the symptom sharer and the symptom bearer motif that I'm putting out there, then what there is this amazing supportive network that they develop where they carry each other and they share with each other and they bear with each other and they support each other. And I think personally, I think that is a really good a metaphor, because I use that a lot in my sessions with clients, whatever they bring in, so.
Well, during some of our discussions as we met and we planned for the show, you did mention to me that, one of the things that you do in your profession of counseling is to help people get through like illnesses and things of that nature. And on the frame of, in the scope of what you just said, one of the great things that I can share is that the support mechanism that Shay gave me was incredibly strong. And it brought to my mind that support mechanism, that symptom sharer that you just mentioned. So as we talk about couples who have got this diagnosis of prostate cancer, what can you say about, the psychological and the mental exercises or the mental experience that people go through when they get news like that? And what are your thoughts and recommendations on how they can deal with them more effectively?
Okay. Now, of course, if you didn't suspect that you had this, if the person didn't think they had this, when they go to the doctor and the doctor calling in and say, listen, this is what's going on, you have prostate cancer. Now, if you go down through Elizabeth Kubler-Ross's progression, the first one is denial. Oh, no, I don't believe this. Mm-hmm. And the denial is an attempt to protect the self from having to deal with the reality. So they go through the denial part, and then after you go through that kind of then there's this kind of anger. Now, the anger could be based on a number of things internally and externally. So socially, there is you go through stuff like bargaining. You start to bargain with God or with yourself or your higher power, your spirit. Say, well, listen, the part of bargaining is, what can I do to change my lifestyle? That's a part of the bargaining process. What can I do? What have I done? How did I get this? Is this thing hereditary? And if it is, I'm not going to give up. So how am I going to, a part of my bargaining process is change my lifestyle. There's a lot of things you have to change when you change your lifestyle, But the first thing about changing your lifestyle is this: you have to change your view of yourself. I'll probably talk about that a little bit more too. So you change this lifestyle. It's part of the bargaining process. And then, and then there's the anger, and then there's the acceptance. And what happens here is this: you come to the conclusion that there is an unwelcomed guest in your life. You didn't raise your hands for it. You don't want it. And this is what I call have but don't want. We all have things in our lives that we have but don't want. We have to battle with those things. And just because we have something that we don't want, it doesn't mean it's going to get up and go away. It doesn't mean that we have, this answer like right now to that. So we have to, we're talking like this, that's an existential stuff. My existence is at stake like right now. Have but don't want. Where did I get it? How do I mitigate it? How do I get rid of this? How will this thing I have but don't want, how will it change me, the bearer, the symptom bearer? How will it change me? So I get this mirror, and I actually use a mirror when I do therapy with my client. I say, you look in this mirror. When they look in the mirror, what they see is this person looking back at them. But I say to them, you are looking at a person. Have you looked into the person? Have you been able to look into the person? A lot of people are not able to look into the person because what you see on the inside of what they see on the inside is really not that pretty. And that might be something coming from childhood, their view of themselves, their picture of themselves. So when they begin to go through all of this, so as they get to, they go down through this whole bargaining piece, and they can vacillate. They can go back and forth. They can go from one step and jump forward. They can camp out in one for a long time. All that stuff. But let me just say this: that when this happens, it changes your view of yourself, right? Mm-hmm. It really does. You begin to see yourself as different. If this is something that society has a problem with, this disease, sometimes what society will do, and you got to be careful that you don't do this, and that is you will see yourself as prostate cancer as opposed to having prostate cancer. Mm-hmm. And some people can't make the difference because they think that if I have it, then that's who I am. And nothing could be further from the truth. So when people are not able to get beyond that, they buy into whatever social stigma is out there. And what that does, it tends to stop you from, it kind of governs the degree to which you are willing to go out and socialize. So now it impacts your socialization with people. Mm-hmm. Mm-hmm. It really does impact your socialization. So you have to ask yourself, if I decide that I don't want to go out there and talk about this thing with people. So how you doing, man? Okay. I don't want to lie and tell them I'm fine. Right. I don't want to lie and tell them I'm fine. I just don't go around them anymore. It cuts me off because I love to be around people, but because I need to defend myself against a stigma that I don't like. And if they find out, then maybe they will abandon me like I am abandoning myself. Okay. You're following me, right?
Absolutely. And reminds me of
it kind of limits my social interaction with people. Let me stop at that, and then I'm sure we develop some other things as we go through this thing. Okay. Well,
just as you mentioned that, it reminds me of the experience that I had when Shay came up with the idea for this podcast. It took me a while to come to the point where I, for lack of a better term, I call it built up the courage to share this with other people. But Shay has a question for you, Dr. Francis.
Okay.
Okay. So, Dr. Francis, I was the person that was in denial more than ill. When we went to the doctor and he got the diagnosis, I was like, I accepted the doctor, like, I'm going to take him home and give him some garlic. I'm going to cut up some garlic. I'm going to put garlic in his soup, garlic in the salad. I just was not having it. I was not believing it. But, I finally got to the point I had to accept it. But the thing that I'm concerned about, that for us, we have a really good marriage and it's a partnership and we're like best friends. But I'm thinking that there are probably couples out there that may not have that. So there are a lot of challenges when you are diagnosed with prostate cancer. You have the surgery. So like you said, socially, it's different. You got to think about going out. Men that have it, we mentioned in our previous episode, they have to wear the pins for a while. So what would you say to that couple, that, the wife may be looking like, wow, you got to do this, you got to do that. Like there is no physical intimacy for a while, for a couple. So I'm imagining that could probably put a strain on a relationship. So would you have any advice for a couple that could be experiencing or going through, or maybe even having some resentment towards the husband just for, being diagnosed or having to go through prostate cancer?
Okay. Yeah. Let me start with you, though, first. This whole idea of you being... this sounds good by you right now. Listen. You're dealing with a therapist, okay? Now, we don't do it. We hear everything. Okay.
Oh.
Listen. You said you want me to keep it real, right?
Yes.
I don't script things. It's going to be really real. So let me get back to you because if a person asks a question, the question is related to the person who asked the question. We know it, right? You didn't try to hide that. So if you and and your husband, have this wonderful marriage, it's not that you have a wonderful marriage. Here's what you have. You have a wonderful interpersonal relationship. People walk around saying they have a bad marriage, and I tell people, I say, leave your marriage alone. Ain't nothing wrong with it. What you have, and I won't go into all that, but what you have is a good interpersonal relationship, which is very supportive and validating and all this kind of stuff. And the degree to which, when you get married, the degree to which a part of your ongoing development on your journey, resides in the other person. And you need the other person to be a particular way so that you can achieve your particular goal. You understand what I'm saying here?
Mm-hmm. Yes.
When that person, whenever there's a change in that person, there is a change in you. Because now the change in that person might stop you from achieving your own particular goal. And so now the conflict is, how do I take care of me while taking care of him? Because I need to take care of him so I can get to take care of me. And so, in all of this, there is this ongoing bonding. And I think one of the things when you say, listen, I'm going to give him all the garlic he can eat. I think what you're trying to do is say, listen, here's a word. I am facing a major loss. The symptom bearer and the symptom sharer are so closely connected like this. And when anything happens to him, it happens to me because I need him to be able to do some things for me so that I can enjoy my life the way I want to enjoy it. And so now this interdependency that you had, it's been wrecked and railroaded. Mm-hmm. You got me, right?
Yes.
Because of this, and I'm going to call it this intruder.
Yes.
Okay. Because of this intruder. So now you have to deal with not only the loss in your husband, but now you have to deal with your own personal interdynamic loss that you're going to go through, because there are some things that just won't happen now because of the loss. Biologically, a lot of things won't happen. Sociologically, things won't happen. Okay. Psychologically, emotions and thoughts, a lot of things won't happen. And you got to be very careful. So now I'm talking to the other set of people. you got to be very careful, because what could happen is that those things could come in and create a separation between an ongoing distancing in the relationship. And it leads to, going back to this, if there's an ongoing distancing in the relationship, and if I have a need that I just have to satisfy, I might leave the marriage and go get satisfied somewhere else. You understand what I'm saying, right?
Don't do that, honey. Don't do that.
That's not me. That's not, we're past that. That's not us.
No. I'm not talking. I'm talking about the other people.
I know.
I'm talking about the other people out there now who might be listening, because this stuff is real.
Yeah, right. It is.
Because you know, I just said HB had but DW. You know we said that, right?
Right.
Well, there's another part to that. It's WBDH, want but don't have.
Mm-hmm.
So when things happen to your husband, and there are things that he can't do, cut the grass, have sex, whatever, it doesn't matter what it is.
Mm-hmm.
And you want him to do that. You have a want but don't have. Why? Because the person who fulfills that want but don't have vacuum inside of you is this man over here who can't function the way you want him to function. Therefore, you go through your loss of want but don't have. What happens to me if I just can't do without this thing that I want but don't have? Now you have a battle within yourself.
Now, how does one get past that? I mean, we're, thank God, on the other side of that, but I'm sure that there are people that, the struggle is much longer, because this process, the recovery can be from anywhere 2 weeks to like 16 months or so. And that could probably be challenging, but thank God we're on the other side. But having gone through it, I know it could probably be challenging.
So we have these people. A lot of people are not willing to commit,
right,
to the interpersonal relationship. Here is what they're willing to commit to. They're willing to commit to what they can get to fulfill their own needs in the relationship or through the relationship. For those people, the marital relationship becomes more tenuous. It's not as robust. You understand what I'm saying? Mm-hmm. And so now you can have all these difficulties that's creeping in. But one of the things that they really need to understand, though, is this, that there are families involved.
Right.
There are families from, children that you have, and then there are extended families, and then there are families of origin, okay? And then there are belief systems, and then there are no-nos, and then there are yes, this is what we do. And so you're confronted with all of these things, all right? People are confronted. And then you said something. Let's say it's not prostate cancer, okay? But this is a lifestyle that somebody had or developed, that the spouse was saying, don't do that, this is gonna happen, don't do that, this could happen, and then it happens.
Right, yeah.
Then it happens, right? Mm-hmm. After the spouse is saying, don't, then it happens. So now that it happens, it shakes their world is changed, and because their internal world has changed, their intrapersonal world has changed, a lot of dissatisfaction, guess what, a lot of anger, a lot of acting out of anger, a lot of distancing, all this kind of stuff, can happen. And so, like I said, when that happens at the dyad level, the husband and wife, at that dyadic level, if you have children, it will change your behavior. And when your behavior changes, it impacts everybody in the system.
Mm-hmm. Mm-hmm.
Everybody in the system. So those things are not private anymore. Your emotions not private anymore. You can hide behind a mask if you want to. You can do that, but here is where you can't hide. And I call this the 2 o'clock moment. So imagine, if you will, like 2 o'clock in the morning, the house is quiet. Nothing is on, it's dark. And I'm laying down beside my wife in bed, and I hear her, I hear her sleeping. Yeah. And my eyes are wide open. And I got things on my mind. This one thing that just won't leave me. And it's consuming my time. I want to sleep, but this thing won't let me sleep. So here I am, worried, just thinking and thinking and thinking. I wish I could kind of sleep it away. Just thinking and thinking and thinking and won't go. So that 2:00 moment, it consumes me so much. I wake up in the morning, so I'm tired. All kind of stuff happens. But not only that, let's shift it over into substance abuse. Now, because this thing is so hard on my brain that I'm thinking about, that's a have but don't want situation, okay? I have this thing I'm thinking of, I don't like that. That's it. So because it's so hard on me, and it's just getting worse and worse, or it's just not going away. Okay, and I grew up, around people, and I know what they do. So I pick up the phone, or I go to the corner store, and I buy me some beer. And somebody said, "Well, wait a minute, I've never seen you drink before. Ain't nothing wrong with me. Something's got to be wrong because you never drink." So now instead of drinking at home, you drink somewhere else, right? Now you're prone to drunk driving, right? Mm. You see how this thing kind of works. So then the drinking or any other type of drug now becomes what I call an emotional anesthesia to stop you from feeling something that you're feeling. And you think that if you anesthetize yourself, it will go away, but it does not go away. It just changes your capacity to feel it for a while. And as soon as that drug wears off, it comes back and, hey, remember me? And it keeps coming back. Mm-hmm. Because when that drug, whatever it is at its highest peak, you are at your highest level of comfort or distance from this thing. And as soon as the power of the drug start to wear off, your discomfort start coming back. So there's this relationship. Less drugs, more discomfort. More drug, less discomfort. So you kind of go down through all of these things. So there's this dance. And so people can actually do that, kind of dance their way out of this. But in this interpersonal relationship piece, because you can't get what you want, you're in this have but don't want state. What you do about it could convert the anger you have towards your spouse. And what you do about it might create some, in terms of your behavior, might create some guilt. Mm-hmm. You deal with your guilt by saying, but if he had listened or if she had listened, I wouldn't be going through this, so I don't feel so guilty. You understand what I'm saying?
Mm-hmm. I want to make it clear one point that we kind of brought up earlier, and that is prostate cancer isn't necessarily a result of a lifestyle that someone chose. Right. It's just, it's sort of like getting, hit by a friendly fire. Okay. But it's just something that happens. And, as we talked about in our opening, when Dennis opened the show, he said, like 1 out of 8 men are going to experience prostate cancer sometime in their life. And for Black men, it's even higher. Right. So Black men have a higher propensity for the disease, and it's more deadly. Okay, once we're diagnosed with it. Right. So as we talk about this, and you mentioned some of the coping mechanisms that people have, which is one of the coping mechanisms that you mentioned was the liquor store, as we say. My wife and I joke about, the corner liquor store. That's one of the coping mechanisms, and some people choose, narcotics or whatever. But what I'd like to ask you to talk about is some of the positive things that people can do. So let's suppose you have a couple who's facing this. And, we're not equipped for this stuff. I mean, we're not equipped to handle this stuff, all the time. Of course, as you mentioned, we're people of faith. But what are some of the things other than prayer, some of the practical things that we can do on a day-to-day basis? My God, I just got this diagnosis from my doctor. How do I tell my wife? I had to build up my courage. It took me a couple of weeks, to tell her that. I told a friend, and I waited to tell my friend after I had gone through the surgery, after I had gone back to the doctor for the post-surgical checkup, and everything was clear. I was in good shape. And then I told him, and he still started crying, after I told him. So what are some of the coping mechanisms that we can use as we face this with our spouse or with our friends and our family?
Okay. So let me say this. I went to my doctor, and, my A1C was kind of they say it was good, but some of the other things just wasn't jiving, So I went and I did a bone marrow, and I did all kinds of stuff like that, So my wife, she is a nurse practitioner. So what do I do? I'm coming home, I'm telling her. She's asking, did you get your results from the doctor? I say, yeah. She want to see it because she understands that stuff. So one of the coping mechanisms then is this, that all of my medical history is wide open to my spouse. When I go to the doctor for those kind of tests, she comes with me. She don't come to necessarily drawing blood, but when I have to go talk to the doctor, she's right there with me. She asks questions that I don't know how to ask. What am I doing? I'm saying to her that I depend on you to help me through this. Why? I'm going to go back to the reason, because I have to depend on her because she is the other. Oh man, I'm going to tell you something. When it comes down to marriage, if you could just see your spouse, take this away. If you could just see your spouse as the other part of you that lives outside of you, and without that other part of you being as well as you want the other part to be, you can't be well. Mm-hmm. So therefore, I treat this as, and I really do take it like this, the symptom bearer needs a symptom sharer to be there. So let me tell you how that works. Listen, if I broke my leg, God forbid, when I did, I broke my foot one time and went to the hospital and they gave me crutches. Those crutches was as much as an important part of my ability to ambulate and move as anything else. And so therefore, I wasn't going to go anywhere without my crutches. So therefore, it became a part of me. So when I see my wife as a part of me, I have to share that. Now, the other thing too that is really necessary is to develop a good supportive relationship. Not because something happened, but just because you need to have a good supportive relationship so that when something happens, that person is available to you. When something happens, she takes on everything about me except my pain. She can't feel my pain, but everything else, she can take that on.
Preach.
She can take that, make that a part of herself. Now, here's what happens. What else I need to do? Do more things together. You discover parts of yourselves when you start doing more things together. And unfortunately, these are some of the sicknesses, illness that bring some people closer together. You know why? Because there's this little word we call dependency. Dependency, the degree to which one is dependent on the other. So now we have interdependency. That interdependency is not shaken. It can get either stronger by this, whatever it is, or it can pull each other apart if the other person goes into shock and denial and say, man, and having a sense of hopelessness. I can't help this. I can't do this. I didn't sign up for this. All these kind of things. But but do more together. You pray together. You certainly take a look at your lifestyle, whatever the lifestyle, there are three main areas that I talk about lifestyle. Do these things together. It's called RAM. It's rest. Make sure you get plenty of rest. Spend more time with each other resting instead of the TV. Okay. And then, not RAM. Sorry, that's another one. It's RED, rest. The E stands for exercise. Mm. You'd be surprised how much exercise can actually prolong your life after it has been prescribed on you to die over a certain period of time. Mm-hmm. Good exercise can do that. Regular exercise can do that. So RED, and then your diet. What do you eat? When do you eat? How much of it do you eat? These things really, those are three of the most important things that people can do. And when you do this together, and it's, I will say to people, the other part of you is not feeling well. How are you feeling knowing that the other part of you over here is not feeling well? What can you, and here's what I say, what can you do inside of you to incite change in the other part of you that's outside of you? So in other words, taking responsibility for, I am only as well as my other part. So doing these things, finding more things to do together, pray more, work out more, eat right, talk right, be supportive of each other, share with each other. Why? Because when you do that, the other person just don't feel so alone.
Right. So Dr. Francis, when Elle was diagnosed, yes, I didn't have anger, but I had a tremendous amount of sadness for him. So was that like inappropriate? Maybe because I guess you can't say what's appropriate for an individual, but that was my emotion.
That was yours?
Yes.
Okay.
Yes.
So you just said something. When Elle was diagnosed, I had a lot of, what did you say? Was it anger?
Sadness. Like I'm sure some people with the diagnosis probably, go through anger. Yeah, that was not me. For me, it was sadness, not for myself, but for him, because he was such an active person, very sociable, exercise, just a person that loves life. And, and so for me, immediately I was kind of thinking like that all was going to change for him. So I just had this tremendous level of sadness for him, not for myself, but just that his life could potentially change.
Okay. All right. So your wife had this sadness, for you. And then she says, your life could potentially change, but her sadness was for you. So I'm going to go back to and say this, Shay, that your sadness was as much for you as it was for your husband. But here's what you did. In order to not having to face the trauma of the sadness, here's what she did, Elle. She transferred some of her sadness onto you, and then she could get into her rescuing mode, okay? She could begin to do all the things she wanted to do to help you to feel better and to make sure you're happy and to make sure you're not sad and, buy you all these things and let's go for a walk and I bought your favorite dessert, all these kind of things so that you are not looking sad. Because when you look sad, she feels sad, but she try to mask it so she don't look sad, so you don't look sad.
Yep.
Yep.
Did I say something?
That was it.
That was it?
Yep. That was it.
Yeah.
Yep. That was it. Light bulb moment. That was it.
That was it. That was it. See, listen, how did I know that? The moment she said your sadness, my mind go back, oh man, we have this great relationship. That just gave it away.
Well, I call her my warrior. Okay. And this is sort of an aside. When we were dating, we were at an event. I had a business. It was a sales business, and we weren't married yet. And we were out of town, and this event that I had, it just so happened that there was a national event at this particular hotel where I was having my event, and it was swallowing up my potential customers. Everybody was going over to this other event. And I saw Shay running around trying to get people, not trying to, but actually getting people from this other event to come to my event. And she was I didn't ask her to do that. Okay. She just did it. All right. And when I say she did it, I mean, she was doing it with fervor. She was serious. Okay. About this. And as I reflect back on that, that was the date and that was the time and that was the event where I decided that was going to be my wife. Okay. When I saw her. And she's always had somewhat of an innate ability and a desire to jump in and save me. Okay. Or to, help me. And so that's what I just heard her explain. I want to take a quick break here and ask Dennis to give some information on Dr. Francis. We want to make sure that our listeners can get in touch with this great gentleman who's providing us all this wonderful information. And I love the analogies.
Look, counseling that I didn't even know I needed.
Yeah. Dennis, why don't you tell the folks how they can get in touch with Dr. Francis?
Absolutely. It's Dr. Kitson Francis. He's founder and CEO of Family Consult Counseling Service in Huntsville, Alabama. And for information on reaching Dr. Francis, you can visit our website, Prostate Cancer Real Talk.
Can I just say something here real quick?
Okay, sure.
So you're at this event, and people are going to other events. And Shay's working as hard as she can to get people to your event. Can I suggest that she did that, probably without knowing that she had taken ownership of your event?
Yeah.
Yeah.
She does that. She does that.
If she took ownership of your event, guess what? She had already taken ownership of you.
Well, it turned out that way. You know what? I'm not complaining.
Listen, not ownership like a thing. It's not a thing. It's emotional connection. You understand what I'm saying? And
yes.
This is emotional connection that she had, brought into her life. She wanted to see. She was probably saying like, if this go well, I go well. He goes well. We goes well. If this go well, I go well. He go well. We go well.
Mm-hmm.
Mm-hmm. And once you get to that place, that's the quality of the interpersonal relationship that I'm talking about. And what you're saying, when you saw that, man, I'm hearing evidence of, man, this woman is really rocking her world, because without even maybe seeing it the way I'm saying it, maybe even at that time seeing you as the other part of her that lives outside of her. And so therefore, in order for her to succeed, the other part of her has to succeed. She's probably practicing on that stuff.
Yes, absolutely.
Yeah.
Absolutely. I will conclude by again thanking Dr. Francis for being with us today. Maybe we don't have to go to church tomorrow, huh?
Let me say, I thank you all for having me on. One thing that I promised myself, I will always have fun. So yeah. I'm just going to cut it up and just go on with it. So I thank you. Thank all three of you for having me on, and just text me, email me, or call me, and I'll be right here.
To reach our show, email Elle and Shay at prostatecancerrealtalk.com. That's EL and Shay, SHAY, at prostatecancerrealtalk.com.